as FCT minister moves to address unregulated practices. Sometimes you even see people at the car park selling drugs. Who are they? Are they professionals? Some can just walk up to you and bring out things from their bag, call it supplement or whatever. Some hospitals are not even licensed. But people go there because maybe it's affordable or something. We have an expert joining us today as we look at this situation. And of course, he's a communist and of course a public affairs analyst. Jide Ojo is joining us via Zoom as we talk about these incidences in FCT, the Federal Capital Territory. Good morning. It's good to have you join us this morning.
Good morning, Ramsey. It's my pleasure. I hope you can hear me.
Yes, I can hear you now. All right. Many thanks for joining us. I want to look at the health sector. A lot of Nigerians are going through so much right now. And of course, myself and my colleague Jumai Manson will be talking with you about the FCT minister's move to address unregulated practices. We have a lot of people who are not experts. We have some hospitals that you don't even know where they get their licenses from. But yet, they still have people patronizing it. How did we even get to this level in this country?
Okay. Good morning, Noah. Happy New Week. We got to this sorry pass because of past successive government inactions and lackadaisical attitude. As you rightly pointed out in your prologue or in your background, what is the ratio of medical personnel to the population of Nigeria? We have a population of about 200 million people, but we don't even have up to 100,000 medical doctors practicing in country. Every month, hundreds of our medical personnel, from doctors to nurses to lab technicians to physiotherapists and all manner of health personnel are leaving Nigeria in droves. Some even are going to other African countries. It's not just UK, US, Germany, or Europe. There are those who have even left Nigeria for other African countries where they have better welfare services. Don't forget, about 3 months ago,
having a little hitch, and that's what he's saying is so true, because if you go to some hospitals today, you see a lot of people. How many doctors do we have? You see people on queue wanting to see the doctor. If you go to the pharmacy, you still see people on queue. How many people do you think a doctor will be able to see in a day? And how many of them will be able to get the necessary attention?
And that is why the quack doctors are now, they've decided to spring up. Now, let's talk about what happened over the weekend. That quack that attended to that woman, the cesarean case that happened, and she lost her life in the process because there was power outrage. There was no power outrage that happened. It's just unfortunate that you see such a thing. Many people come up, and of course, I hear our guest has joined back on.
So, like I was saying, a couple of months ago, FCT doctors have to go on strike. On 3 days, resident doctors went on 3 days warning strike because of welfare issues. I remember I did an article in my column in The Punch where I was shocked by the pictures painted by the president of Association of Resident Doctors, Abuja FCT branch, that in some hospitals, government-owned hospitals, there is no water. They have to be using their resources to even provide basic medical supplies. And that is the worrisome situation. So if government hospitals are nothing to write home about, what do you expect an average citizens to do? You have to go and patronize. How many of us will go to any private health facility and start asking for the certificate of the doctor or for the
Exactly.
license of the hospital? Do you even bother? Because if you are sick, you are sick, and you are just in a hurry to get back on your feet. So I don't think we should blame the victim. The FCT minister is just playing catch up. I do not expect that under his watch, health practitioners, doctors will be going on strike. I just told you about the 3-day warning strike of the Association of Resident Doctors, or FCT. That was about February this year. And they painted so much, when you read their demands, you will know that we are just in the hands of God. That is why many people resort to faith clinics. They would rather go to Afa or go to church or go to Abba homes to get cure, because not only are the government hospitals in short supply, they are not well equipped, they are understaffed, and even the private health facilities that are available charge cutthroat amounts that you cannot afford. The woman that died in Durumi, you don't know what the entire story is all about. From what I gathered, the doctor was able to save the child, but the mother died. But are you saying that in government-owned hospitals, pregnant women don't die? It's all part of the bragado that FCT minister is trying to do. I've told you under his watch the sorry state of our health facilities in FCT, not to talk of Nigeria as a whole. So because one person died in a private health facility, it has generated a cram down. Does FCT minister want to tell us that he doesn't know, or the mandate secretary in charge of health in FCT does not know the existence of these quacks or unlicensed private health facilities? Again, very recently I did an article on the state of fake drugs, fake and adulterated drugs. After the NAFDAC clamped down on Idumota in Lagos, Aba, and Onitsha Edbridge supply chain, where they recovered over 1 trillion naira worth of fake drugs that have been in circulation. You ask yourself, how did you allow this to happen? Many of us, when we are sick, you go to chemists, we call them chemists, that's health stores, drug stores. Do we even ask whether the owner of the drugstore is licensed? Do we ask whether he has a qualified pharmacist to attend to our health needs? We just go there, and if the drugs are too expensive, we leave. So, of our own volition, we are looking for cheap drugs. And when something is cheap, ridiculously cheap, you should know that there is tendency for that drug to be substandard, fake, or expired. So we are in a very dire situation. We are in a very dire situation. I will not lie to you. In terms of health, it's God that has been taking care of average
Exactly.
Nigerians.
All right, Mr. Ojo, I have a question to ask. Talking about these illegal facilities and these quote and unquote, these unregistered doctors or pharmacists, but some of them have been in this particular business for years. They've been in this business for some 20 years and they're doing amazingly. What do we make up of those particular individuals? What do we say about them? That are quote and unquote saving lives, but of course they're not registered and they've not gone through the rigorous training of being a health practitioner.
You see, anyone that submits himself or herself to the attention of an unlicensed health practitioner is taking a gamble on his life. Because somebody, I mean, even when the Durumi Health facility, it has not yet been established what is the qualification of the doctor that carry out the cesarean section. He possibly have been carrying out this same cesarean section for decades, but despite not being licensed or maybe unqualified. But you see, it's a huge risk one is taking. It's okay if you don't know that this man is not licensed or is not qualified. But if you do know and you go to such facility, then you don't love yourself. And I don't think we should encourage other citizens to continue to patronize unlicensed and unregulated health facilities. The FCT minister is now talking about people not taking advantage of free health insurance in primary health centers in FCT and all of that. How many people are aware? Is the needed awareness created for people who are pregnant to know that they can have free access to antenatal and cesarean section? Do they even know how to enroll on the free health insurance scheme? The point is there is need for proper sensitization and awareness. We need to create the necessary awareness. I do not know that pregnant women can access free health care in government-owned hospitals in FCT until when I read the publication that pregnant women can have free antenatal and free delivery services in our FCT primary health care centers and hospitals. But the awareness possibly is very low. And that is why I think our regulatory agencies need to do a lot more. As to the question you asked, I think the regulatory authority, the Pharmaceutical Society of Nigeria, the NMA, Nigeria Medical Association, need to work collaboratively to go around often, weekly, taking different areas of Abuja and Nigeria to go on inspection. In fact, let me shock you, my dear sister. There are some health facilities that are actually registered but have unqualified medical personnel working in there. I don't know whether you are aware that majority of nurses in private health facilities are auxiliary nurses. We call them auxiliary nurses, who are just like somebody who went to learn from roadside mechanic, who just go through maybe 3 or 6 months of tutelage under a medical doctor. You cannot compare that kind of capacity building to somebody who went for 3 years nursing training. And that speaks to the issue of availability of health practitioners. As I've said earlier on, many of our health practitioners are leaving Nigeria in droves because of the very precarious situation across health facilities in the country. In fact, let me cite the example of University College Hospital Ibadan to you. Did you know that early this year, around January, February, the Ibadan Electricity Distribution Company had to disconnect the public electricity supply to UCH? That's the foremost tertiary institution in Nigeria. They were disconnected from national grid on the basis that they were owing about 500 million naira in unpaid electricity bills. So when you look at the entire problem or challenges in our health facilities, you know that it's God that has just been taking good care of many of us citizens. How we manage to survive day by day, particularly when we are sick, is just a miracle. And that is why government need to double down. Incidentally, health is under the concurrent legislative list. It is what federal, state, and local government can key into. There is no exclusivity. But what we have seen is that majority of the funding and provisioning for health facilities in Nigeria is done by the federal government. Many states' health facilities are grossly under-resourced. They don't have enough medical personnel. They don't have, sometimes they don't have electricity. That's why I laugh when they are accusing where Mrs. Jide died in Durumi, when they said lights went out. Even in government-owned hospitals, lights do go out. I've read about doctors using phone touch, mobile phone touch to carry out medical procedures,
Operations.
including cesarean section. In government-owned facilities, I'm not even talking of private, where they use phone touch, touch on their mobile phones to carry out medical procedure. Is that all right? It's so unfortunate, my dear
All
sister
right,
and
Mr.
brother.
Mr. Jide, I have a question to ask. You mentioned auxiliary nurses. I've seen a particular pharmacist, a pharmaceutical facility, and then you wonder, and what you see is someone that just graduated from secondary school and he's in front of the desk and he's prescribing drugs to you. I have seen that. Now, as a Nigerian, as an individual, creating that awareness, how do I know that this particular pharmacy is registered or not? What should I have at the back of my mind? It doesn't matter whether it's very big or a very medium-sized pharmacist or a pharmacy or a small. What will I have in my mind at the back of my head so that I would not be prescribed wrong drugs in the cause of getting cure for a particular maybe headache or malaria or something?
My dear sister, you know what you can do. First is to watch out for the license. It's usually hung at the entrance of the health facility. Usually you have it, if a medical facility is registered, the first thing you enter, as you enter the reception area, you will see it hang at the entrance or somewhere in the reception. But how many of us even bother? How many of us care? How many of us will ask whether a particular health institution is licensed or not? We just want to get cure. The Pharmaceutical Society of Nigeria will tell you that don't patronize health facilities where you don't see RX, a kind of cross with RX, outside or on the signpost of that facility. But I've patronized a lot of pharmacies, a lot of drugstores. I don't bother to check. What I bother about is just to see whether the health facility, whether the drug I want to buy is actually available. That's usually my primary concern. And people have said, when I was researching for the article I recently wrote on the state of fake drugs and fake and expired and some standard drugs, I discovered that many a time we are dealing with three different categories of drugs. There are those drugs that are substandard in terms of production. They are not up to standard. There are those that are expired, and there are those that are completely fake. And that's why some drug, what you are supposed to do, some drug have a QR code on the package, on the pack of the drug, that you can scratch. It's like a scratch and win stuff. You can scratch it, and then you text the code on that scratch to a particular what's it called? Particular dedicated number. It's like an SMS, and you are supposed to get immediate response to say, yes, this drug is certified, is standard, and all of that. But how many of us bother? How many? Really speaking, how many? And many of the drugstores that are licensed are usually not operating in the urban centers. I mean, they are not operating in the suburban environment, rather, because in the suburban environment where the roads are bad, where people are in the communities, who wants to go there on inspection in any event? And you now want to buy drug. Maybe you have to take a bike or take a taxi that will cost you some thousands of naira. You would be thinking about the cost benefit. And unless that drug is not available in your immediate neighborhood, you will not want to spend some 5,000, 10,000 to go to town in search of a particular drug. So a lot of awareness needs to be created, and we need improvement in our economy so that people will stop killing themselves. Because deliberately, even when you go to a drugstore, a pharmacy, and they give you 2 brands of drugs, you are most likely, an average Nigerian is most likely going to buy the cheaper one, not minding whether that cheaper one is fake or expired or substandard. And you know, the catch is usually that when they give you, there are brands of paracetamol that are manufactured abroad, and they cost almost 4 times the one manufactured in Nigeria. So if they tell you this particular brand is foreign, this one is local, and you just say, give me the local one because it's cheaper. And mark you, it's not only drugs you want to buy with your resources. There are other bills to pay: school fees, house rent, you have to eat, you have to transport. And so how many of us are earning enough to take care of our bills? Many of us, including myself, are heavily indebted. We are owing so much, and we pray that we don't fall sick. And when we do fall sick, we are looking for cheaper alternative to getting us back on our feet. So it's a conundrum, my dear sister and brother. It's a conundrum that we are just living by the grace of God. We are just living by the grace of God. I've heard several stories of how people have died out of negligence, not even medical practitioners' negligence, but their own personal negligence. When you buy fake drugs, it cannot work. And once your system forms a resistance to that drug, it then means that one may be on its way out of this world. So a lot needs to be done, but I think the economy, we pray that the economy will improve, because when the economy improves, then we will be able to have more resources to take care of our medical bills. Do you know that we are advised to go for thorough medical checkup twice a year? That every year, 2 times, you go for thorough medical checkup. But if I ask you and Ramsey, Juma, if I ask you and Ramsey whether you have ever gone for thorough medical checkup, I'm sure the answer may likely be the negative because of the cost implication. Because of the cost implication. And then
Funny
you
enough,
still have to deal with the issue of high cost of drugs, high cost of health services. There are some hospitals, before you are even attended to, you
very
are asked
true.
to deposit 50,000. Look at the case of the pregnant woman that died in Lagos, where the health facility the husband took her to, the husband was asked to deposit 500,000. Where will he get it? A woman that is already at the point of labor, and the man is struggling to even piece some little resources together. But the medical facility said unless 500,000 is deposited, they will not attend to the woman. And the woman eventually died. I think she died with the pregnancy. So these are avoidable deaths. But a lot needs to be done in terms of healthcare delivery in Nigeria.
All right. Thank you very much. Let me, because you've made a lot of sense right there. As it is, One of the things you've been talking about is the fact that Nigerians, most Nigerians resort to that aspect, patronizing quacks and fake hospitals that are not registered because of maybe affordability. Now, two questions I want to ask in one. These hospitals, it is supposed to be believed that they have people who regulate the activities of these hospitals, who registers them, and who go about to check whether or not these hospitals are fake or whether original, as the case may be. Same thing with the quack doctors. Now, what can we say about the people who are in charge of regulating and ensuring that all hospitals in FCT are registered? Why do we have a lot of facilities not registered? Then that's one. Then secondly, we've had cases of fake drugs being administered to people, being bought from the shelves at pharmacies, the medicine stores, by people who are not experts or professionals in quote. What do we say about people at the border? Because most of these drugs are even exported into this country. You've seen some broadcasts on social media where they will tell you, well, if you see this kind of drug, you don't buy, and all of that is being imported from some countries. I won't mention the names now. What happened to the people at the border? Who is holding them responsible, and why are they not being held responsible for these drugs escaping them? We will hear fake drugs being burnt by NDLEA and all of that. What about the people that allow these drugs into this country? Because Nigerians, most times people don't ask. They just go get these drugs because the number one priority at that point in time is how lives would be saved.
The issue, Ramsey, is that there's a lot of corruption in the health value chain, a lot of corruption. One of the questions I asked when I wrote on the incidence of fake drugs, was it last month? I think it was last month in my column in the Punch newspaper. I followed all the drug busts by NAFDAC in Onitsha, in Aba, in Lagos. And I didn't read of any arrest that was made by the NAFDAC officials. They only talked about, oh, we were able to seize drugs worth 1 trillion naira. But what about the culprits? Because if you don't arrest, investigate, and prosecute the culprits, they will go back into that business of endangering our lives. Any medical practitioner that is unlicensed, that is unregistered, or pharmaceutical company that imports or produces fake drugs, adulterated drugs, or substandard drugs is endangering the lives of ordinary citizens. And it can be anybody who will fall victim, including a minister, including a director, including head of agencies. How many of us study pharmacy? How do you know that a particular brand of drug is fake? Do I have the expertise to know that this particular drug has even been ruled out? Did you know that for many years, people are still administering chloroquine for malaria when it has been banned for over 30 years? That people should stop using chloroquine to treat malaria. But some people, when they have malaria, they will even of their own accord ask them at the drugstore that they want to buy chloroquine, and it will be sold to them. I know of incidents of importation of fake drugs by some unscrupulous importers and drug merchants from Asian countries like India, China, and some other countries like that. And you ask yourself, if they are Nigerians, do they ever think that the evil that they are sowing will not be reaped by their family members? Because you want to make blood money, you import expired or fake drugs or substandard drugs, do you know when it gets to those drugstores, whether it's your mom or dad,
Okay, I think we'll have a little hitch there from maybe the network. But then, like what I was
is that
saying,
it's a catch-22 situation that concerted efforts need to be made by all and sundry to help in the fight against these incidents of fake, substandard, and expired drugs. And it's not just drugs. Do you know that many of our wine and spirits that we consume in this country are fake, substandard, or adulterated? Even beverages, you buy some beverages of popular brands that have been faked, and then you drink it, and then you start having running stomach. Even water, many water factories are unlicensed, and then they produce and circulate sachet water, bottled water for people's consumption. It's not just about drugs. It's a very complicated challenge, health challenge we have, because you see, many have died as a result of what we are discussing this morning, like the issue of unlicensed, unqualified quacks who are attending to patients. You know, that is the fastest way to death, because this person has not been trained, yet he will tell you, I'm suspecting you have this. There will be, he will even send you to lab to go and do test, or he will send you to lab to go and do wrong test. He doesn't know how to analyze test results, may end up administering wrong drugs, or carry out procedures that will endanger the life of the patient. And many have died of undisclosed undisclosed medical negligence. And that is why you ask that right question: what are the authorities doing? We have the Nigerian Medical Association, we have the Pharmaceutical Society of Nigeria, we have other regulatory bodies and agencies. Why have they been sleeping on duty? Why have they not been up and alive to their responsibility? I will tell you part of the reason. Because these organizations are grossly understaffed, under-resourced. Did you know that throughout this country, the entire staff of NAFDAC is just about 2,000 personnel to fight fake drug, adulterated drug, not just drugs, including wine, including food, including spirits that people consume. And what will 2,000 personnel do across 768 local government and 6 area councils? If you do the division, assuming they post some of their personnel to local government, does NAFDAC have local government offices? At best, what they have is state offices. And
okay,
some of the state offices are not even well informed.
Well, our time is up. This is not a topic we can actually finish in just one discussion, because I wanted to ask a lot of other questions.